Questions. We move on to other questions. Question number 6 on the name of Deputy Haughey. I understand Deputy Keller is taking it. Minister, your response.
Thank you very much. Likewise, for the record, I very much look forward to working with Deputy Kelleher in his role as his party spokesperson on health. I know his role he's carried on for a number of years, so I look forward to working with him. This is an important question. Improving access for patients is a key objective for our public health service. The 2016 HSE service plan undertakes to maintain the 2015 levels of service in respect of scheduled care and to continue to address waiting times as part of the regular performance and accountability process. The HSE seeks to ensure that those whose clinical needs are most urgent are prioritised accordingly, whilst managing the needs of those who have been waiting the longest for routine treatment in chronological order. Currently, for the information of the House, 94% of patients wait less than the maximum waiting time of 15 months for inpatient, day case or outpatient procedures, with over 60% of those patients waiting less than 6 months for their required care. A scheduled care governance group has been established within the Health Service Executive to coordinate key initiatives to reduce waiting times and the number of patients awaiting treatment. Actions overseen by this group include driving greater adherence to chronological scheduling, relocation of low complexity surgical procedures to smaller hospitals, and administrative and clinical validation procedures to ensure that patients are available for treatment. All too often I do hear stories of people who even passed away still remaining on a waiting list, and the difficulty that can cause for their family as well as for the accuracy of the list. Each hospital group has been mandated to designate a key person to lead and support waiting list management improvements so as to advance us towards compliance with maximum waiting times. The National Treatment Purchase Fund supports the management of inpatient, day case and outpatient waiting list by working with the HSE to assist hospitals in developing local demand and capacity planning and providing technical guidance materials to ensure the highest standards of data quality and practice. My department, as Deputy Keller will know, is currently engaging with the NTPF and the HSE on a focused plan for endoscopy waiting lists this year, and the programme for government and indeed the supply and confidence arrangement with the Deputy's party does contain a commitment to reactivate the NTPF and indeed to provide €15 million in 2017 to address waiting lists, and my department will engage with both the NTPF and the HSE in this regard.
Thank you, Minister. Deputy Billy Carroll.
Sir, look, I mean, this is a sad indictment. Being truthful, over the last number of years we've had seen an escalating increase in the number of people for inpatient day case treatments. We're now at 74,000 plus, Minister, for that. And then for outpatient appointments we've gone to 407,000 people. And there has been a process of assessing the lists over the last number of years. So, I mean, the lists are reasonably accurate, because I know there was a fair due diligence done on them in recent years. Now, the previous minister set a target of 15 months, which was a less ambitious target than the minister prior to Minister Varadkar. So, I mean, it's backwards we're going in terms of adjudication of our success or failure in terms of our ambition. And clearly this is an issue that has to be addressed. Now, I know that you've had a meeting with regard to your winter readiness programme, and I acknowledge the fact that at least you're preparing in time. But one of the solutions to winter readiness is the cancellations of elective surgeries and scheduled treatments, and I just do not believe that that can be seen as a long-term sustainable solution to overcrowding in our emergency departments. So all in all, Minister, I mean, the National Treatment Purchase Fund is there. I hope that is utilised wisely and efficiently, but this issue of 407,000 people outpatient waiting list is something that is a sad indictment on everybody, because these people are unsure exactly of what is wrong with them until they have been diagnosed.
Thank you, Deputy.
Yeah, the Deputy makes a fair point. I suppose firstly, for the 15-month target that you referred to, as I said in my initial response, 94% of patients are being seen within that 15-month target, and actually 60% of patients are being seen within the 6-month period. But we've got to continue to strive to do better. What we're seeing here, though, is a direct result of a period of very difficult economic decisions through the time of my party was in government in the last government, and indeed your own party in the government before that. We're now in a different place. We are now in a place where we will begin to reinvest in the health service, where we will be increasing health budgets and increasing the amount of resources going to try and tackle the very issues that you're outlining. I'm not afraid to admit when I hear a good idea from somewhere else, and I accept that the NTPF was a model championed by your own party, and I think it has a role to play here. I think it needs to be reactivated. I think we should all be striving to invest funding in the public health service, absolutely, but there is a role for the NTPF here in trying to get down waiting lists. I want to start a programme for endoscopy with the NTPF this year. I want to put at least least 15 million into the NTPF for 2017, and I want to have conversations here in this House about how best to actually target that in terms of the most difficult and acute types of treatment that are needed. The final point I'd make, Caherlock, in relation to the Winter Initiative, you are right. We've got to be very careful that the consequence of preparing for the ED situation doesn't actually take away from the waiting list situation. And the way you best do that is to increase resources in the health service and indeed to increase recruitment and retention of frontline staff.
Prime Minister.
Just on an side, Minister, but a very important issue is the issue of access to diagnostics and direct referrals by GPs into diagnostics. I mean, the situation that we have presently and why we have such a build-up of people on waiting lists is simply the inability to access diagnostics, and we just don't seem to be sweating the assets of the public diagnostic services, where they're working on a 5-day week. And I just think that if we could be imaginative and creative in ensuring that we can change the rostering programme, make radiography and other diagnostic services available on a 7-day week basis, and look at using and utilising the huge capital investment that has gone into that over the last number of years in ensuring that we have greater capacity in the public health system with regard to diagnostics, might be an area that you might, I know you're aware of it, but I mean, we have to accept that that is a key area with regard to access to diagnostics.
Thank you,
Caherlock. You're correct. I recently met some of the representatives of the radiographers, and actually radiographers within our public health service saying we want to do more, we're willing to do more, and we're exploring with the HSE the additional tasks that radiographers want to take on, which will actually then lessen the burden on other parts of our health service, where you have healthcare professionals putting up their hands saying we're willing to do more and play a role. It's very important that the HSE responds positively to that. In relation to access to diagnostics, we've got to also make sure that the diagnostics are available where possible in the community, keeping people out of the acute hospital. I do think sometimes we can clap ourselves on the back too much for building a primary care centre. The real question we've got to be asking ourselves is what's in the primary care centre. It can't just be a fancy GP centre. It's got to have the diagnostic equipment, and there is a commitment in the programme for government to look at how we can incentivise healthcare professionals to provide diagnostic equipment within the community so that the primary care centre really can provide actual primary care and get the diagnostics done locally in the community.
Thank you, Minister. Question number 7 in the name of the Deputy